Good evening, everyone, and welcome to tonight's webinar. Our topic is Effective Parenting, Balancing Family and Multiple Sclerosis. My name is Ann Lee, and I'm the Senior Specialist of Programs and Online Education for CanDo Multiple Sclerosis, and I'm happy to be your moderator this evening. If you're not already familiar with our programs and with what we do, CanDo MS is an innovative provider of lifestyle empowerment programs for people who live with MS and also for their support partners. And through our programs, we empower people to actively co-manage their disease and move beyond their MS by adopting healthy and active lifestyle behaviors. And on the screen here, you'll be able to see some of the programs that we have to offer. You can find all of these programs at our website at www.mscando.org. You can register for upcoming webinars such as this one. And you can also view our archived webinars on our website. All of our webinars are recorded and also archived on our website for you to view. And we also have our 3 in-person programs. We have our 4-day flagship CanDo program, our 1-day Jumpstart programs that happen all over the country, and we also have our 2.5-day Take Charge program that takes place this year in Oakland, California. So again, please feel free to visit our website to find out more information on those programs. And you can also connect with us on social media. We have a very active Facebook page where you can learn about our upcoming programs and events and find any up-to-date information regarding what we've got going on in your area. We're also on Twitter, and you can also find us on LinkedIn and on YouTube. Our YouTube has lots of fun webinar recordings and other fun videos that you can browse through and view. And so just a few housekeeping items before we begin. We will have a question and answer portion of the webinar at the end of the program. So if you have questions that come up throughout the program, feel free to chat your questions to me on your screen. If you look on the bottom left-hand side of the screen, you can just type in your question there, chat them to the presenters, and we will keep track of them. And hopefully we'll get to as many questions as we can at the end of the webinar. If you also have a question, you can also raise your hand. You'll notice that feature, and I'll be able to chat with you to see exactly what your question might be. And again, this webinar is being recorded, so everyone's phone lines have been muted, but the webinar is being recorded, and you'll be able to revisit our website to review this recording tomorrow afternoon if you're unable to stay with us for the entire program. And before I introduce our speakers, I did have a question to ask everyone. The question on the screen is, what age range do your children or your grandchildren, if you happen to be a grandparent, fall into? So if you can just mark the age of your child or your children or your grandchildren here below, this will help our presenters be able to speak about our topic tonight. So you can go ahead and log your answers in. And once we get everyone's responses in, we can skip to our results. Just give everyone a few more seconds. Okay, so it looks like we have quite a range here. It looks like 25% are between the ages of 0 to 5, and then another 25% are above the years of 20 or above the age of 20 years old. And then we have about 18% between the ages of 6 and 10, 22% between the ages of 11 to 15, and 7% between the ages of 6 to 20. So we have quite the range here. All right, now I am very excited to introduce our presenters for the evening. We have Dr. Crawford. Dr. Crawford's training and clinical experience as a health psychologist for more than 20 years has afforded her the unique opportunity to work with and learn from individuals and families living with MS. She's had the privilege to share in the life stories that define the journey over the course of MS and have reflected these stories in presentations, research projects, and publications. The courage that women women and men with MS display when facing difficult challenges has been an inspiration in Dr. Crawford's work and in her personal life. As a member of the staff at the MS Center at the Cleveland Clinic, the Can Do MS family, and most recently the Department of Neurology at the University of Cincinnati Medical Center, she has had the opportunity to connect with professionals as well as individuals with MS and their families. These relationships have nourished her passion for working in the field of chronic illness, just as time in Maine has nourished her soul. And our next presenter is occupational therapist Laura Kingston. Laura Kingston is an OT in Portland, Oregon, and she has been a Can Do programs consultant for 12 years. She graduated from the University of Puget Sound in 1996 and has had 18 years of experience working in neurological rehabilitation in the acute care, inpatient, and outpatient settings. Currently, she works full-time at Providence St. Vincent Medical Center, which is ranked as a top 100 hospital in the country, which is located in Portland. Welcome, Laura. And finally, our last presenter is Jennifer Smrtka. Jennifer Smrtka is a board-certified adult nurse practitioner and board-certified multiple sclerosis specialty nurse. She has exclusively worked in MS since 2003 as a clinician, clinical instructor, consultant, and a clinical research investigator. She has worked in both the academic and private sector and MS centers throughout her tenure as an MS nurse practitioner. She is an active member of the International Organization of Multiple Sclerosis Nurses and has been a board member in 2008. She has been a consultant nurse practitioner for Can Do MS organization since 2008 as an active volunteer with the National MS Society, MSAA, and the MS Foundation. She currently has a private MS practice in Boca Raton, Florida. So I'd like to welcome now Peggy, Laura, and Jennifer, and now I give it to you to take it away.
Thank you, Anne. You know, it's not uncommon for parents with MS to grapple with the question of whether or not to talk with their children, even adult children, about their MS diagnosis. There is no right or wrong answer, but in general, we feel the many benefits of talking about MS outweigh any potential risks. Keep in mind that although MS occurs in one person's body, it is a condition that affects the whole family. What we often hear is that although children may not spontaneously bring up questions or express their concerns, it doesn't mean they're not noticing that something's different about you, that they're not thinking about your health, or noticing that there's a change in your behavior and function. And one of the things we find is that if you don't talk to children, they tend to fill in the blanks themselves, often with misinformation, sometimes by talking to people who are clearly not as well informed about MS as you are. And currently, we hear that many school-age and adolescent children will just go to the internet and start looking up your symptoms, sometimes concluding that you have a condition that is not MS, and in fact, in many ways, far worse than MS. So we feel it's worth talking about. Often parents hesitate to talk to children about MS because they assume that it will make children worry and feel anxious. But in fact, it usually has the opposite effect. We find that when children are kept out of the loop, they tend to really worry more. One of the things that talking about MS does is it helps you to develop a common language for you and your children. This lays the groundwork not just for effective communication about MS, but all of those issues that come up over a lifetime between parents and children. Talking also increases your children's understanding of your symptoms, and particularly invisible symptoms, because those are the ones that are hard for people, including adults, let alone children, to understand, and very easy for them to misinterpret. And here I'm thinking about symptoms like fatigue, pain, visual symptoms. Also, I want you to think about this talking and communicating about MS. It's an ongoing opportunity over many episodes to reassure your children about what you're doing to take care of yourself. That's very important to them, to know that you're doing what you need to do. Once people have made the decision to talk with their children, they often wonder how to go about it. And one of the things we often encourage is that you provide developmentally appropriate information, and there are many ways to do this, using programs and materials from all of the MS organizations. And remember that very small children, and since we have so many children in the 0 to 5 age range there, they're very concrete. So if you have an AFO or brace on your leg, they're going to assume your leg is broken and that that's temporary and your leg will be fixed over time. School-age children really can absorb a fair amount of information, and there are wonderful materials for them, including a newsletter from the National MS Society called Keep Smiling. And adolescents and young adults clearly are able to think in much more abstract terms and know that MS is not going away. You want to tell your children, in some cases, if they're not asking you particular questions, you might anticipate some of their concerns. Often, school-age children in particular want to be reassured that you're not dying and that MS cannot be caught like a cold. It gives you an opportunity to reassure them that you will continue to play an active role by making every effort to maintain their routines and activities. And just remember that most kids are pretty self-centered, so they're mostly concerned about how you having MS is going to be affecting them. So keeping up their social, athletic activities and school routines, very important. We also feel that it's useful to talk with children kind of on an as-needed basis, or as they need to know things. So when you're going to have a significant change in your symptoms or your treatment, where you're going to start using an assistive device, a cane or a rollator, or you're going to be taking a medical leave, let them know that that's about to happen. Also, children want to know that you have a plan for how to take care of yourself in risky situations. I've known children who worry when they're at school, if they have a parent who falls sometimes, that when they hear a siren, there's an emergency and their parent must have called for EMS. So they want to know that you have a plan in place and that you're going to follow through with a plan that's very reassuring to them. Some specific suggestions about this whole process of talking with your children. Sometimes it can be very helpful to describe your symptoms in very concrete terms. And also, you can have your children do things like put Vaseline on eyeglasses and wear them so that they know what blurred vision looks like. Put a bandage or an ACE bandage around their leg so they feel what spasticity is like. But they really, I think, can appreciate your symptoms if you describe them in those concrete ways, and also how the symptoms affect you and the things that you do on a day-to-day basis. Sometimes it can be helpful to invite your child to accompany you to an MS visit so that they can see what actually happens and what doesn't happen, because kids associate doctor visits and nurse visits with things that happen to them. So, taking them along and letting them see what actually happens can be very useful. It can also be helpful, even sometimes, just to schedule an appointment to talk about MS and review educational materials. This provides your child an opportunity to ask questions of someone other than you. And I've had many parents shocked over the years at what children will ask somebody, a healthcare professional, that they have never, ever brought up at home. It can also be helpful to talk about the unpredictability and variability of your symptoms, that whole process that we know occurs, that you can do something on Monday and maybe you can't do it so well by Wednesday. And that's very hard for people, including children, to understand. This sometimes is going to result in a change of plans, so that you might need a rain check, or someone else might need to take them to a sporting event or accompany them to some activity. You can also be a positive role model for your children by talking about your MS, for example, by letting them know that you're going to ask for and accept help when you need it. That is very reassuring to them. People with MS and their families generally cope better when people take good care of themselves. Jen, do you have recommendations for how people can do this?
Yes, thank you, Dr. Crawford. In fact, going back to her point about being a positive role model, as parents, we take on this responsibility of really setting examples and leading and showing our children kind of how to model after us. And so what I tell parents who are living with MS, or even parents who have children living with MS, is that it's never too late to achieve wellness despite having MS. And the reassuring thing I like to promote in my practice is that because you've been labeled as having a chronic illness, does not designate you to be chronically ill for the rest of the days of your life. And in fact, you can achieve wellness and health despite having a chronic illness. But there are some commitments you have to make to yourself. And this really is very general for those living with MS and those who live with someone who has MS. Things that we need to commit to on a day-to-day basis as a lifestyle is really diet and exercise. And I'm not talking about a strict regimen. I'm talking about a lifestyle. And also the importance of adopting healthy habits. And it's never too late to adopt a healthy habit. We know, based on 3 different research trials, that when people smoke, if they have MS, they are actually significantly progressing their symptoms and expediting progression of the disease than someone who does not smoke. And the risk of developing MS for a smoker is much higher than someone who doesn't smoke. So even if you are a heavy smoker and you have MS, I encourage my patients to try to smoke even 1 less cigarette per week and try to do a slow wean as opposed to a cold turkey stop, if you will. The importance of wearing seatbelts and going to annual routine visits with your healthcare provider. These are things that we should be modeling as parents for our children anyway. These are just basic healthy adaptations, things like brushing your teeth twice a day at least, flossing once a day, making sure you're seeing your dentist regularly, trying to decrease salt and sugar intake in your diet, and managing your sleep cycles. We'll get into sleep a little later, but these are just basic things that we discuss in clinical visits to try to encourage people, again, to be empowered in the fact that you've been given a diagnosis, and it may be perceived as a crisis. It may actually be an opportunity for you to take steps and directions to really change your life and impact your health for the better. We also will go back to Dr. Crawford later to talk about how to reduce stress, but that is a very important concept as well in trying to achieve a healthy state of mind and of life, is really the mind-body connection and really recognizing that your attitude can very much affect how you feel and vice versa. So getting into kind of specifics with dietary modifications, we don't have any one prescribed diet for MS. Many folks who live with MS come into my office and will ask me about the SWANK diet because it's probably the most common and most, I don't want to say commercialized diet, but probably the most well-known diet in terms of living with MS. And Dr. Roy Swank actually did about 50 years of research on his diet that he created for patients who had MS. And at the time that he created this diet, you have to recall that it was prior to 1993 when the first disease-modifying therapies became available. So at the time that he developed this diet, there were no other interventions for people living with MS. So he really put a lot of emphasis on lifestyle. And what we can say is that from a medical standpoint, the research that he conducted was not scientifically rigorous in that he didn't have kind of the gold standard clinical trial design by which you have a placebo double-blinded randomized clinical trial. But what we can say is that the people that he studied, and he did research for over 50 years looking at their diets, 95% of them did report to feeling better. Now, again, that may not be terribly scientific, but when it comes to you and your body, nobody knows your body better than you. And certainly we know that what you put into your body can make a difference on how you feel. We have looked at other studies in MS in terms of low-fat diets and also omega-3 fatty acid supplementation. And it has been suggested with these clinical trials that there may be moderate benefits in terms of relapsing remitting MS and patients that are also concomitantly taking medications. So in conjunction with a disease-modifying therapy, we encourage people to try to eat whole, healthy foods. And my general rule of thumb for patients is that if it can remain on your kitchen counter for more than 5 days and it doesn't change its color, its consistency, its shape, or its scent, it's probably something you want to consider twice before putting into your body, because it's probably loaded with a lot of preservatives and chemicals that you simply don't need. The other thing a patient told me, said, well, if my grandmother didn't recognize it, I generally won't put it in my mouth. And I think that's probably a wise thing to live by as well. And in terms of lifestyle, when we talk about exercise, I put this slide in here for levity just because I think most folks who are working, or certainly if you're a parent, you can appreciate fatigue just from parenting alone. You may not carve out time for yourself to exercise. And certainly, the remote control doesn't count as lifting, heavy lifting. So we do encourage folks to exercise. And the exercise that I talk to my patients about is, look, your body is designed to move. And although you may have a neurological condition that impedes that movement, we have to determine what you can do. And by determining what you can do, we want to try to exercise and encourage those muscles to move. Because remember, MS doesn't affect the muscles per se. It affects the nerves that innervate the muscles. So if we can create a conditioning of the muscles, they will have memory. And even despite having weakness because of nerve cells not being able to communicate to that muscle, we can still achieve some type of conditioning despite having lack of innervation. And that's where physical therapy can be very helpful if somebody is really immobilized. But even passive range of motion can be very helpful, and that is considered exercise. So what I generally tell folks is this, is if you can get into a routine that you do more today than you did yesterday, whatever that is, that's where we want to see progress. I don't expect my patients to go out and start a 30-minute exercise routine. Everything is built on something else, and so starting little by little and building on those blocks is what we want to try to promote. So we know exercising in general is good for your health. Unfortunately, having MS does not inoculate you from having any other conditions such as hypertension or cardiovascular disease or being at risk for stroke. So exercise will help promote good health and also help to decrease the risks of additional diseases. It certainly helps prevent osteoporosis as we get older, and weight-bearing exercise is the best way to do that. In addition, if we can create strong bones later on in life when you are at a higher risk of falls, for all of us, we are less likely to have fractures if we've done some weight-bearing exercise as we're younger. It does help improve fatigue. We do get an energy spurt from the endorphins that are released after we exercise, and we also help you to sleep deeper at night, which will help you feel more rested in the morning. So it is also, we know, a very effective treatment for depression and other mood disorders because those endorphins contain the neural and biochemicals that we have, serotonin, norepinephrine, and dopamine. And ultimately, it really should become part of the lifestyle. In terms of sleep, if we could bottle sleep, if we could figure out a way to bottle sleep and prescribe it, we would be doing quite well, because I think, in fact, it is the most essential lifestyle piece that is often missing, especially with folks who live with MS because of maybe bladder dysfunction or pain that keeps them up at night, or anxiety. So if we can establish a good, healthy sleep pattern, we can hopefully mitigate or minimize the effects of the symptoms that may be preventing somebody from having good sleep to begin with. We see sleep disorders commonly in people, and they sometimes are a result of even medications. It can be, unfortunately, a side effect. Insomnia can be a side effect of some of the medications we prescribe. Unfortunately, we know if you have a sleep disorder, we can see an increased risk of other disease states such as cardiac disease, hypertension, obesity, and diabetes, as well as stroke. So they certainly, if you have sleep deprivation, it definitely contributes, we know, to depression, to cognitive impairments, to pain, and to fatigue. And oftentimes, if I have somebody who is having trouble with sleep, we will try to rule out and determine the underlying etiology, if there are things that we can intervene with in terms of lifestyle changes. The biggest one probably being turning off the TV at least ideally 2 hours before bedtime. Many people fall asleep with the TV, and we now recognize that it's probably one of the worst things that you can do in terms of getting a good deep sleep and getting those sleep cycles started. But oftentimes we will refer people to sleep management as well for a sleep study if we cannot make lifestyle changes or determine an underlying etiology for the cause of insomnia. So I'm going to ask now Dr. Crawford if you have any specific strategies looking at managing stress and knowing that stress is obviously a huge issue with anybody, but especially parents either living with MS or who have children with MS.
Sure. Thanks, Jen. Often one of the things that people I've met over the years have been told when they're first diagnosed with MS is that they should now avoid stress. And I actually think that's really bad advice, first of all, because it's impossible. Stress is everywhere, and you can't really avoid it, and it's useful to know how to change things so that you can limit its impact and the effect that it has on you and consequently on the rest of the family. One of the first things I often suggest to people is that they think about all the situations, people, things in their life that are contributing to stress. They make that list, and then they take that list and they divide it into two lists. One of stressors, sources of stress that they can do something about that are probably more controllable, and the second list of things that they probably can't really change, kind of like one is the behavior of other people. That tends to be a longer list. This actually helps you to identify your priorities. So which stressors are you going to target? It's also very helpful to pay attention to warning signs that stress is taking a toll. For example, many people talk about how their usual everyday symptoms of MS tend to increase when they're really stressed. So it feels like someone has come along and turned up the volume on your symptoms. That could well be an indicator of stress. Often, too, mood changes. And when people are stressed, they tend to feel more irritable, have a shorter fuse, and parents tell me, I'm yelling at my kids, I feel really bad about it, and I just don't seem to be able to stop. And stress can also affect people cognitively so that it makes it difficult to concentrate, pay attention, be effective and get things done, be organized. So these are kind of the early steps in stress management. How do you deal with stress in the moment? So you're in a situation, you're feeling stressed, and you really need to do something right then. What I encourage people to do is kind of step back, sort of take yourself out into the audience. You're watching a show. That show is your life. And you look at the situation, you examine it. If it seems like something you can fix or really change, then you come up with a plan of action and you carry it out. If not, there are lots of things you can do to sort of help yourself calm down, de-stress, and regroup so that you can move on with the rest of your day. And I'm not going to go through all of these, but just things like slow, deep breathing, massaging your own temples. One of my favorites is taking a 10-minute time out. And believe me, when I've suggested this in front of kids, they love it because they think that timeouts are just for kids. So they love the idea that adults might take a timeout. Thinking about a peaceful situation. And last but not least, and one that's very hard for people to do, is consider turning off your cell phone or ignoring your email for even half an hour. So those are things you can do right now. And strategies for managing stress sort of more in the long term really go back to what Jen said about a healthy lifestyle. This is trying to build your personal resources, keep your gas tank always at least half full, and your battery charged, so that eating and sleeping and regular exercise, having routines. Realistic goal setting. I think often people stress themselves out because they set goals that are way too big, way too vague, and they can't really tell when they've achieved them. And the idea is that you want goals that you can complete so that you have success, which motivates you to keep trying something else. A form of relaxation. Everybody needs one, and this is an activity that you want to do on a very regular basis. What people tend to try to do is when they get super duper stressed, then they try to do something that's relaxing, and it's almost impossible. So you want to do this sort of like a daily vitamin. You want to do some daily relaxation. Even 10 minutes can make a difference. Maintaining strong relationships, strong connections with other people, preferably relationships that are mutual so that you're both giving and receiving in the relationship. Mindfulness activities we now know are very beneficial for physical and emotional health. And mindfulness activities really mean focusing on your emotions, your physical sensations, and your thoughts in the moment. So this refers to things like meditation, yoga, tai chi, but even a simpler activity is take something that you do every day, several times a day, like washing your hands, brushing your teeth. Slow it down and really focus on how does it feel. How does it feel with the soap on your hands, with the water running and rinsing you off, and that massaging your own hands. That is a mindfulness activity. Also cognitive behavioral techniques that you can learn and implement yourself. When people are stressed, there is a cognitive component, so you're thinking something and talking to yourself about the situation. You make an interpretation. That affects your mood and thus your behavior. So cognitive behavioral techniques really help you develop new ways to think about problems and better ways to deal with them. So multiple ideas. It's always good to have more than one. I want to talk a little bit just about effective coping with MS in general. Over the years we've found that people who view MS as a series of challenges and opportunities for growth rather than threats and something to be afraid of and avoided or unsolvable, people who see it as a challenge tend to just cope better over time. I encourage people when they say, how am I going to cope with this, to think about developing a tool belt that holds a variety of tools for coping that complement each other. I always say to people, you wouldn't want a tool belt with 5 hammers and nothing else. You want a variety. So things like being flexible, being willing to do things differently, perhaps more slowly, over more time, with assistance at a different time of day. Things that are flexible tend to bend and not break, and people are included in that. Seeking and accepting help as needed, that's a sign of strength. I know it often feels like a sign of weakness, but it really takes a lot of guts to stand up and let somebody know that you need help and then to accept that help. A daily dose of resilience along with that multiple vitamin, if you take one. The resilience is really the capacity for psychosocial comeback in the face of adversity, and it means putting one foot in front of another, being persistent, focusing again on what you can do. Also being creative and generating multiple solutions for problems, so if the first one you try doesn't work, you've got something to fall back on. Also, seeking professional help, especially when your mood and behavior are getting in your way of having the kind of relationships and productivity and mood that you really want to have on a regular basis. We've been talking about managing stress and MS in general, but Jen, could you talk specifically about managing MS symptoms?
Sure, Dr. Crawford. So, everyone who has MS, if we put everybody in a room and went around the room and asked everybody to describe their MS, even if it was just a group of relapsing remitting MS folks, everyone would have a different story, and their symptoms would look different, and they would be perceived differently and maybe experienced differently because everyone is different. So there are many ways that we look at trying to break the cycle of MS symptoms, and one of it is looking at what are your own personal management styles. And part of that is what Dr. Crawford was saying is, what are some of your coping mechanisms? How can we delve into your own resources to try to manage some of these symptoms? And some of it may turn out to be lifestyle changes. And as a nurse practitioner, I prefer to try to go with lifestyle management first and foremost, as opposed to pulling out the prescription pad and giving folks a pill or a prescription if if we can try to alleviate or mitigate symptoms by simply changing things in terms of lifestyle. We also call on our other resources and support systems in terms of family and friends, and hopefully all of you out there, if you have MS, you've determined and found a healthcare provider who really is acting as a partner with you in this and helping you to achieve the goals so that you can obtain health and wellness despite having MS. And then, of course, we also do recommend medical therapies, certainly the disease-modifying therapies and acute relapse treatment if it's necessary. But in terms of self-efficacy, we really try to empower folks to manage the symptoms with as least amount of medications, obviously, because they tend to cause side effects. And then we're chasing our tails with multiple medications and polypharmacy. So a couple of the things that I wanted to focus on specifically when we talk about parenting in MS is really focusing on fatigue in MS. Because unfortunately fatigue is inherent in MS, and I would argue that it's probably inherent in parenting as well. So we know that there's definitely an association between fatigue and heat in MS in terms of the UTAS phenomena. And unfortunately, most folks with MS prefer not to drink a lot because oftentimes they feel as though if they're drinking a lot, they're running to the bathroom a lot. And as a result, become quite dehydrated and then no longer have a very good ability to regulate their internal temperature or their internal thermometer. So unfortunately, it's this kind of negative cycle, downward cycle that, you're dehydrated, you get hot, your MS symptoms manifest themselves, and until you cool off or rehydrate, the symptoms may be very pesky and cumbersome, and they may cause you to have more fatigue. So we also know that, interestingly, fatigue really does seem to precede relapses, and it can be very prominent during a relapse. And we see this oftentimes. Folks will come in and they'll tell me that, a week or two prior to them having an acute new onset of symptoms, they had significant fatigue, much more so than what they live with on a daily basis. And then oftentimes people will be quite fatigued during a relapse, and then, of course, after when they're recovering from either the treatment itself or the actual relapse. So, and sometimes we have seen that fatigue could be the first presenting symptom of MS. It's not common, but definitely I have heard patients remarking on that. So in terms of any parents on the line who don't themselves have fatigue, it's important that you understand fatigue in MS because the person that you love who lives with MS is not lazy, they're tired. And it's not tired that you or I experience just because we're parenting. It's tired that's a lassitude. It is simply a feeling of you can't possibly do anything else. And I have a dear friend of mine who has progressive MS, and she's probably been one of my best teachers in terms of really making it relatable to understand fatigue and MS. So how she describes it for those folks who don't have MS, she says, imagine you wake up at 5 in the morning and you decide you're going to go for a 5-mile run. And then you come home and you decide that you're going to clean your house. And you're going to include washing the windows and ironing and doing the laundry. And then you decide probably you should prep for dinner. But you do this all before noon. So imagine how you'd feel at 2 in the afternoon. And now, I'm not that ambitious, but I would imagine you'd be exhausted. And she said, Jen, that's how I feel when I wake up sometimes, even after 8 hours of sleeping. Sometimes I'm so tired I just can't even read. I need to put my head down. And a lot of times patients have described it to me as they feel like sometimes they're an appliance and they've been unplugged. There's simply no more energy to put into any meaningful task that they need to do. So I just like to describe that for folks who don't have MS so you have a little bit better understanding and perhaps more compassion for your loved ones who live with MS. And certainly as parents, if you have small children, you may be contending with all types of things that are keeping you up at night. And that certainly can be an overwhelming sense of tiredness during the day. So we know folks who live with MS generally about 75 to 85% of folks experience fatigue, and it can be severe or it can be moderate, but generally daily they're living with fatigue. So it's a pretty universal symptom that we see. And 30% of patients actually will have fatigue that occurs before the symptoms of the disease actually manifest themselves. So again, it's not terribly common, but we do see it. In terms of how we manage it, and again, I go back to the first thing we do is try to manage lifestyle changes. So, we look at how are you sleeping at night, and how are you when you wake up. If you're tired when you're waking up, is it because you're not sleeping at night, because you're running to the bathroom, or because you're having leg cramps? Or is it simply because your bed partner is a snorer? We have to kind of look at the whole picture and really determine what is the cause of the daytime fatigue. And if you're a parent, it may be because you have a little one who's wandering into your bedroom at night saying they need a drink of water or they need to go to the bathroom. So we have to kind of really look at it and see if we can manage it. Then we also promote things like exercising during the day, and a lot of times folks will say, well, I'm so tired I can't even imagine exercising. Well, even working with a physical therapist and doing some passive range of motion can improve the sense of feeling refreshed during the day and help you sleep better at night. And oftentimes we look at ways to effectively conserve energy, and Laura will actually go into that a little bit later about what are some of the things that you can do to manage energy conservation. And then least and last, we will implement medication if necessary, but we really try to hold off on that if possible. Okay, so in terms of additional ways to try to manage fatigue, I highly encourage rest periods, and we oftentimes will write letters of medical necessity for folks who work, so that if they need to, maybe they have the flexibility, they could work from home 1 or 2 days a week. We also have tried to implement, family and friends taking kids, say, for a couple hours on Sunday or a couple hours over the weekend, just to give parents a break. And certainly, if moms have MS, they need the opportunity and spousal support to maybe they prepared dinner with the family on Sunday and freeze the food so that they just take the food out during the week. Or maybe the spouse does the cooking at night who does not live with MS. We also say things like set priorities. Kids are resilient, and if they have a parent who has MS, they're not going to remember that mom didn't cook a 3-course meal every night. They're going to remember, did she not spend time with me? So try to schedule activities that are easy versus difficult. Remember the role of exercise. Exercising as a family is a great thing to do. And again, as a parent, you really want to model a healthy lifestyle for your family, regardless if they have MS or you have MS. And then ultimately, in terms of getting some concrete specifics for managing fatigue, we'll often refer to a physical therapist and to an occupational therapist. So I think now I'll ask Laura, if you can expound on ways to modify activities, hopefully to minimize fatigue for folks living with MS.
Sure, Jen. Thank you. So definitely one of the roles that an occupational therapist holds is to really help a person better manage their day with the energy they've been given. And I really feel like what we can do is sit down and just talk to you a little bit more about how to go through an activity analysis. And that really looks at looking at the tasks that are at hand, that are presented in front of you, and how can they be broken down into more manageable steps or simplified. And this is definitely an art, and it takes a while to master it. But if you can look at the energy you've been given for that day, and each day it might look different. As Dr. Crawford and Jen have mentioned, some days when you wake up and you have MS, you may feel fairly well if you're rested and you're able to get a good night's sleep and your medications are working for you, and all those other things that can factor into feeling restored. But then there will be some mornings where you'll wake up and you'll just feel exhausted before you've even begun. And so if you look at the tasks that you have at hand in front of you, it's really figuring out how can I simplify and break down these activities so they're more manageable for my day. And really a lot of that depends on how well you can pace yourself, plan how you're going to go about your day, and prioritize. And I know both of them have mentioned just the importance of doing that, and it's huge. And if you can pause for a minute as you get up in the morning and think about, okay, how do I feel today, and what am I really going to be able to try to accomplish realistically, I think that in itself can definitely help you feel like you have a little bit more control over your circumstance, and especially just juggling spending time with your children and all their activities that they have, and especially if you're involved in driving them to different activities and picking them up at school, and their friends are coming over to play at the house, even to then planning an activity later with your older children in the evening. And so as an occupational therapist, we can look at that more on how can you break down tasks and simplify your day. There's also tools that can be used to help just manage cognitive and physical fatigue, and a lot of those, have to do with using an assistive device. If you find that you physically are getting tired by the end of the day, are you using something that will help you better manage your physical energy? Do you need a wheelchair for part of the day to balance your energy for later, or are you, when you take a shower, are you using a shower chair to sit down while you're bathing, so then later you have energy to go to your son or daughter's track practice, or if you're going out as a family to dinner? So those are things just to keep in mind as you begin your day. And then also utilizing community resources. I mean, the National MS Society and all the other MS groups that are out there have so many community resources available, and it's just a matter of looking into those things and figuring out what's available for you to help just make your days a lot easier. Now to go to a few practical just tips and ideas. As a new parent myself, I definitely have realized the importance of energy conservation and just how valuable your energy really is throughout the day, and that it needs to be sustained as long as possible, because some nights you may not get a very restful evening and you have to just keep going. And so anything you can do during the day to simplify things, I've found has been so helpful. So a few little tips here on the next slide here has to do with thinking about as you're running errands, do you really need to go out into the community and go shopping and get in the car and in and out of different stores, or are there some things that you could actually just order online and have them shipped directly to your home? And a lot of the different websites are like Amazon, and these are just a few, it's not partial to one or the other, but we'll even have free shipping depending on how much you spend. And so if you can plan ahead and know that you are going to need to purchase diapers, or you want to buy your grandchild's gift for their birthday, or just different things, you can go ahead and pre-plan and try to order some of those things online and not even have to run out to go purchase items in stores, which is definitely more fatiguing. A few practical tips too, with just infants. Those of you who have infants, I'm thinking about as you're running errands, definitely put their car seat in their stroller when you're out versus trying to carry the car seat with your child in it. One, that's just very fatiguing, but also just for balance and safety and just trying to juggle everything. I have definitely found that using the stroller can help tremendously when you're out and about. And also try to group your errands to some places that have just multiple items in one store, for example, like a Target or Walmart or any store that you can shop and acquire multiple things, which is wonderful because it minimizes the number of trips you have to spend in and out of the car and loading your children in and out. but also for your own energy too, calling ahead and really writing your list out and your strategy for the day and how you're going to tackle that can definitely help you with your energy management for the end of that day, but also to pre-plan for the next day as well. A few other tips on energy management. Prioritizing tasks in the morning, possibly when your children are at school or while your baby is resting. And I think that's a very important just concept, because if you feel your best in the morning and you're not able to maximize that time, but there's still things that need to get done later in the day, it's going to be more difficult and more fatiguing for you to try to manage those things when you're exhausted. And so, again, it does go back to pre-planning the tasks that are at hand. And trying to incorporate one rest break in the day, possibly while your children are at school or when all is calm, or if you have a spouse or a family member that has your children for a while, especially maybe once they get out of school, using that time to just try to rest or do something that will help you get centered. And as Dr. Crawford and Jen both mentioned, exercise is an important thing as well. And if that might be the time that you can incorporate that into your day, that's a wise time to try to do it and maximize those moments. Pacing yourself is important, and just learning how to say no to extras if energy is lacking. And I know sometimes that can be one of the most difficult things, is saying no to some things, because you may have a list of things that are all good and all things that you feel like are important to be accomplished. But there comes those days where you cannot do it all. And so just practicing the art of saying no, it's a discipline, but it can definitely allow you to feel better throughout the day instead of feeling exhausted by 2 p.m. And then by saying no, too, you can reserve your energy for a fun family outing, or knowing that you may have a family dinner planned with everyone going out, which is so important, as Dr. Crawford mentioned, just to keep a routine with your children and really try to stay as involved as you can in their extracurricular interests, because that's another way of just showing them that you know what they're doing, you're interested in what they're doing, and you like to be part of it. And as you're able to engage in those moments, I'm sure for them it's worth its weight in gold. And then the next slide here just goes on to talk about recruiting when possible. And this, again, talks about really working on asking for help at times and trying to schedule either a family member or a friend possibly to come over for a few hours a week to help you with a few items around the house, or even if they can spend time just watching your child for an hour or so that you can either rest or go do something else that's going to help you stay well and healthy overall. And then one of the things, I haven't had the opportunity yet, I have just a 7-month-old right now, but having a weekly chore list around the house and, keeping the house up a family event instead of having all the weight on your shoulders to do everything. And it's a good way for the kids to see how they can be involved, and also, again, understanding possibly what your limitations might be, and that might be physically or cognitively, and how they can be a help to you, but they will also see that you're still helping be involved in the home as well. And posting that list up on the refrigerator or somewhere where everyone can see it, I think also is an important thing, so it's front and center and everyone knows that they're a part of this team effort in the house. And then really thinking about, as you're heading up that list, picking which tasks may be easiest for you and the least exhausting, and then try to delegate the rest of the tasks to your children if possible, or to your spouse or other family members. So Dr. Crawford, at this point, do you have some other suggestions on how to maintain a healthy balance in managing MS symptoms and parenting?
Sure, Laura, thanks. I think that we've certainly been encouraging you to involve your children in your MS by sharing information, experiences, educating them. And I think as Laura just said, it's okay for your kids to assist you if there's something upstairs that you need and you've already made your 2 trips up there today. It's okay for your children to assist you with that. We don't necessarily, though, encourage children to be your primary source of physical support or emotional support, and certainly not the provider of your personal care, as that's really best done by another adult. So I think this is certainly a place where balance can be achieved. And one of the questions that often comes up, and I think we have a question about it tonight, is the whole issue of how do you discipline young children when you have MS with symptoms including maybe extreme fatigue, difficulty walking, because there is a physical component to just finding your children and sometimes chasing them down if they misbehave. And more than one parent over the years has described a misbehaving 3-year-old who runs up to the top of the stairs and stands up there with her hands on her hip and a look that just tells you she's daring you to come up and get her, and you know that that's not going to happen. So this is why we encourage people to focus on the behavioral and communication aspects of discipline, so setting clear and consistent expectations, reinforcing positive behavior. Even little preschoolers do well with a sticker chart with 3 behaviors that you expect them to do every day. So I think those are the aspects, and actually those are the aspects, I guess as a psychologist when I've worked with families with children, that we would want parents to be using for discipline anyhow. Identifying trusted and dependable people to help you in your home, with your children, giving you a breather, a morning off is really essential. And it's good for your children to have a bigger group of people that they know that you trust and can take care of them. If your MS symptoms interfere with your ability to do things with your children, it's okay to be honest with them about what's happening and also how you feel, that you feel sad about not being able to do something with them. What this does is it provides them an opportunity to talk about how they feel, and maybe they feel sad too. If this doesn't happen, sometimes over time children actually build on some anger and resentment. But if you talk about it as you go along, that's much less likely to happen. And in general, we want you to focus on what you can do as a parent as opposed to what you feel you can't do. And Laura, I was wondering if you could share some ideas about activities that parents can do with their children.
Well, sure. Thank you. So the next few slides that we have focus on just some ideas of ways that you can spend time with your children, and whether those times are spent at home, or the latter slides will go over are just some creative ideas or websites that you can go to for, as summer's nearing, travel tips and ideas for getting out and about with your family. But spending time with your children at home, more often than not, you probably, with the energy that you have, are home often. And with that, it's good to have kind of a whole bag full of ideas, or just a variety of different games and tasks that you can play with them, and projects and things that you can do at home where you can kind of moderate your own energy levels while you're with them. And for the younger children, or even junior high or high school age, the Wii is still a great tool. I'm not sure how many of you may have one of those at home, but it gives you a variety of fun games and activities that can be graded depending on your ability level and plus the children's interests. And so, anywhere from bowling to playing tennis on the computer to, playing basketball, and they have the Wii Fit that you can use. And it's just a great way to still engage with them but be inside. And most of those games as well can be done sitting. And so if you are wheelchair bound or your balance is an issue, a lot of these games still can be done sitting comfortably, and but the kids can still have fun interacting with you doing those things. Board games are another idea, or just other games, especially for older children as well, that you can engage with on the computer. It can be fun as long as it's interactive. I think that's the most important thing, that you're able to interact with them instead of just sitting watching TV. And these are all ideas, hopefully, that will allow you to engage with them while you're with them. Craft projects is another idea that's great. I know growing up, my mom, we had so many different craft projects going, and it was just so much fun being part of that with her, and then also having a fun completed thing that you're so proud of to have done, with your family. And so I think that's a great way to engage, especially as the weather is still right now a little bit iffy in different parts of the country, and it's not as easy to get out and about. That's a great one as well. And then for parents who have younger children, I think this is a great way, again, where you can interact with your children but still be at home. And by putting in one of the play structures in the backyard, and granted I know that these are not the least expensive things to put in, but it allows you still to be outside with them, sitting and enjoying their company, and they can be running around getting all their energy out playing, but you do not have to leave the house. So those are some ideas for just in the home. And then the next couple slides, I included this one here. And these few slides are just kind of a sampler platter of what's to come for next month's webinar, which is all focused on travel for the summer and just being able to get out and about and engaging with families. But this slide here has to focus on a little bit more on the outdoors. And I included a few websites. The National Park Service website is a great one if you go under that and then type in the keyword search handicap access, and it'll give you ideas of different parts of the national parks that are accessible, whether that's using an assistive device or a wheelchair. So that's a great site to go to. And then also a few of the others, so Wilderness Inquiry, that is a wonderful group and nonprofit. They're actually based out of Minnesota. That they have, so many different ideas of trips that are based at national parks, but also in the Minnesota area if you're from that area. And you just go underneath, there's a section called Supported Programs, and then within that you click on Project Fit, which stands for Families Integrating Together. And it's a portion of their nonprofit that really focuses on adaptive equipment and activities that families can engage in together out in the wilderness, river rafting, hiking, going on trails that are more handicap accessible. And then the other group, too, I just listed is Adventures Without Limits. And that group's actually based out of Oregon. But they have, again, adaptive travel ideas. But I'm sure as far as outdoors activities, if you just Google adaptive outdoor travel in your areas, you could find some other organizations, too, that might be a little closer to home. And then the last slide here, this is just more of general travel resources. And I looked up and listed a few of the key ones that I thought would be most helpful, but this is not an inclusive list at all. But the Society for Accessible Travel and Hospitality is one. The disabilitytravel.com website is primarily for people who need an assistive device to walk or a wheelchair, and it's a vacation planning website, which is kind of nice. And then the next one, the Accessible Travel Guide website, gives tips on accessible restaurants and sightseeing places in a variety of cities in the United States, which is kind of nice because that's definitely more of a local site where you can go depending on where you live around the country, and they list some accessible places that are easy to get in and out of. And then the Access-Able website focuses, it's a guide for travel worldwide, and it actually includes cruises that are kind of handicap accessible, but also just more worldwide travel ideas, especially if you are in a wheelchair or you need a scooter. They even have rental sites that you can go to if you do not want to bring your own scooter or wheelchair with you on the trip, ideas of where you might be able to rent those while you're on your vacation with your family. And then the last one, the Global Access News website, it's another worldwide travel site that helps with trip planning tips and ideas for getting out for the summer. And then the National MS Society is always a good resource for everyone, especially this time of year, and of ideas in your local chapter areas that they might be able to give you as well. So that is that. This exciting summer's coming, and it's good to just begin to think about possibly some of the things that we can all do to engage with our families this summer while the weather's nice. So Ann, I think I'll give it back to you as far as questions. And
sure.
Okay.
Well, thank you so much. We did get a few questions in, and I think one of them was actually answered by Peggy, which was on disciplining young children when being so overwhelmed and fatigued. But we do have another question, and Peggy and Jen, I think this might be good for you. The question is, people say that they understand when you tried to explain fatigue to them, or they understand how fatigued that we can get, but then they seem to don't remember that regarding expectations that they have of me. So what are some ways that I can deal with those expectations and helping to manage the fatigue that I'm feeling and being able to communicate that to the other person?
Well, I can start. This is Jen. What I would recommend first is to educate or re-educate, if you've already explained to them the fatigue that's associated with MS. And there is some really great literature available through like the National MS Society and Multiple Sclerosis Association of America that you can download or even get sent to you that really nicely describes in black and white how fatigue, how common it is in MS, and what are the kind of real life feelings that somebody has who has MS in terms of their fatigue. And sometimes, unfortunately, our loved ones don't really hear it until it comes from a third party or sometimes an objective outside party. They may not remember or heed all of your kind of education. And so I think that's helpful. But also then coming back to you in terms of setting the appropriate expectations. And I think oftentimes moms especially will try to do it all. And I think sometimes it's important to reiterate the fact that, in my opinion, Superwoman is not a real person. And you can't do it all. You can do a lot of things, but you can't do everything. So I think it's important to set realistic expectations and appropriate boundaries, and also remember that parenting, it takes a village. And when you have MS, it also takes a village. And recruiting people to help you, and the power of being able to say, no, I am not able to do that at this time, or no, that doesn't work for me. And not even having to explain or provide an explanation that it's the fatigue that's causing you to have to set limitations. So I'll turn it over to Dr. Crawford if you have anything to add.
Yeah, Jen, I think those are some great ideas. I wholeheartedly agree with the possibility of having a third party, and I know sometimes I've had families come in and someone's been very frustrated that their husband and children don't understand about their fatigue, and I talk about it and they say, oh, okay, so it's real. And so I think that can be infuriating, but on the other hand, I always tell people if it works, go with it. And so I think sometimes because it is invisible, people truly just don't get it. So I would take advantage of all the healthcare providers that are helping you with your MS. Bring family in, have a family session, and go to it to talk about this. I think the other thing is empowering yourself to develop some assertive skills and say the best word that people can learn is no. And you don't have to apologize. I, again, agree with Jen. You don't have to explain. You don't have to apologize. But that's not going to be possible for me this week. If it's something you really want to do, you can say, could we plan it for another time? So I think, you can certainly give people alternatives. But I think this is just, you got to just keep going over sometimes the same information. But I think your behavior has to be consistent then with what you're saying. So if you keep doing what they want you to do, and they keep asking, people are going to take the path of least resistance. If you do it, they will ask.
Excellent. Thank you, ladies. We have another question here. My children are 13 and 9. They have learned to wear me down until they get their way, and I think you may have answered this a little bit. I get exhausted and eventually give in. Do you have any advice?
So as a parent, I would say consistency, consistency, consistency. They know they can wear you down consistently, they will. If you continue to say no, that's not how we roll this way. We're not rolling this way today. But you have to be consistent. I mean, kids, and I'll let Dr. Crawford expound on that, but you have to say what you mean and mean what you say and be consistent.
Right, absolutely, and follow through. And I think, one of the things that sometimes happens is one of the ways kids wear people down or people wear people down is through irritation and anger. And angry people are tough to be around. So most of us do want to go the other way, or we do want to sort of give in and get them off our back. But I think then it just reinforces it. So again, they are going to do what works. And so if they know they can wear you down, they will continue to do it. So I think I would have a discussion. One of the things I've suggested to people is having family meetings. You pick a day or an evening of the week. Everybody's expected to be there. It can be short. People can put suggestions or questions in a box so they don't even have to put their name on them or whatever. And this can be one of the things that you talk about. So sometimes talking about an issue when you're not in the moment, when you're not in the heat of it, can be really helpful. But I think letting them know they're gonna, there's a new there's a new sheriff in town, and you can be the new sheriff, and that it's time for some change.
Yeah, and I would go back to also the fact that, as parents, we really are teachers, and you teach people how to treat you. And your children, in an empowering way, you can take kind of the emphasis and say, you know what, I'm teaching them self-respect and self-discipline by showing them that I respect myself and I am disciplined enough to stick to my word and stick to my guns. And certainly if you're a single parent, it's that much harder to do that because obviously you don't have the same resources in terms of just energy levels or support. But if you do have a spouse who is available, make sure they're on the same page with you.
Perfect. And our final question is, do you know of any parenting education for parents who also have cognitive delays, and if any of these classes exist?
Well, this is Dr. Crawford. I don't know of any particular classes. I guess what I would suggest is, one thing would be to talk to the local chapter of the National MS Society in Philadelphia, which is extremely active, and find out if they're having any programs, any educational seminars, that kind of thing on cognitive issues. And one of the things in that might be to talk about how that affects parenting. But the other thing is just to find out more about cognitive impact from MS in general. This might be a topic also for a support group, but I would definitely contact the local MS Society.
Great, excellent. Thanks, Peggy. Well, I think those are all the questions that we have, and we actually had a comment from one of our participants saying that these were all great suggestions. So I hope that these were all helpful tips for everyone, for all of the parents that are on the call tonight. I know that as a child, I was kind of called out on some of the things that I would do to take advantage of my parents. So I think we're right on point here. But again,
thank you
again.
Alone, yeah.
I know. So thanks to Peggy, Laura, and to Jennifer for joining us tonight. And I did just want to remind everyone that we do have some other resources on our website. We have our e-news, which is our monthly e-newsletter that we have sent to all of our program participants, and you can also find them archived on our website. And we also have our Ask the Can Do Team program online. Basically, you can just submit your questions online, and one of our programs consultants can help answer those for you. And if you think of a question from tonight's webinar and you think of it after the program's over, you can just submit it online and we can forward them over to one of our programs consultants and get them answered for you right away. We also have our Can Do library. You can access library articles on all sorts of different topics on health and wellness and MS. They're all written by our MS experts and program consultants. So again, please use our website and use Can Do MS as a resource for you, for yourselves and for your families and for your support partners. Our next webinar that Laura was kind of referring to in our last few slides is on tips for traveling with MS. We've got the summer season kind of coming around the corner, and Julianne Hansen-Sladov, who is our occupational therapist, and Amanda Rohrig, who is a physical therapist, will be talking about how we can travel with MS. And so that's on June 10th, same time, from 8 p.m. to 9:15 p.m. Eastern Time. So please remember to register for this webinar. And we look forward to working or hearing from you again next month. And once this webinar is over, you will receive a survey that will appear on your computer screen. So just please take a moment to complete that survey and share your input. All of your feedback really helps us to improve on our topics in our webinars. You will receive a copy of tonight's webinar slides by email, so please look forward to those. And again, I want to thank Dr. Crawford and Laura and Jennifer, and thanks everyone for joining us, and we'll see you next time.